A very good afternoon to our viewers tuning in today. My name is Barbara. You are tuning into the Malacca Manipal Medical College Specialization series, where today we are focusing on dentistry and the dentist road to specialization. Joining us today, we have Professor Dr. Noorliza Mastura Ismail, who is our head of department for community dentistry, as well as Associate Professor Dr. Preethy Mary Donald from the Department of Oral Medicine and Oral Radiology. Good afternoon, Prof.
Good afternoon.
Good afternoon.
Thank you so much for joining us. Right, we're going to quickly introduce both professors to our viewers today, and we'll start with Professor Dr. Noorliza. She graduated from University Malaya, where she did her BDS. She also holds a diploma in dental public health from the Royal College of Surgeons, England. She also did her Masters of Science in dental public health there. Apart from being our head of department and a academic professor with Malacca Manipal, she is also a member of the accreditation body under MQA, a member of Cleft Lip and Palate Association of Kelantan, Malaysia, as well as a range of other associations related to dentistry in the country and internationally. Joining her is Dr. Preethy Mary Donald, who graduated from the A.B. Shetty Memorial Institute of Dental Sciences, India. She did her Masters of Dental Surgery in Oral Pathology and Microbiology in the Meenakshi Amal Dental College. And she's got an interest in research where her most recent publication was on oral health related quality of life and the index of orthodontic treatment need to evaluate the association of patients' self-perceived need and normative need towards orthodontic treatment. That's very interesting, Dr. Preethy, and I will definitely be asking you questions about that later on in our segment. So without further ado, Prof, if you could each give us a brief on your area of specialization, because our viewers today are mostly future dentists who are either embarking on their BDS journey or is already in their BDS journey. We'll start with Professor Dr. Noorliza.
Yes. All right. Can you hear me?
Yes. Loud and clear.
So I have taken this field, dental public health, or commonly also called community dentistry. And this specialty is a very unique specialty whereby what we do is to try and help the community in the aspect of prevention. And then we give health education and we practice health protection by recommending policies to the higher authorities, right? And usually people in this public health specialists have a more exposure in administration and planning. So that's why you see the director of oral health officers, oral health section, or the state pengaras or the state directors are all dental public health qualified. This is how we were trained, and we are actually administrators more than clinicians.
Okay. And do you have to, so is it, would you say this is a desk-bound job, or it's a mix of staying in the office, discussing policies and moving out to people in the communities and stuff like that?
This specialty is also called the busybody specialty. We will be everywhere. Everywhere where the community is, you'll see our faces. This is where we reach the community. We are not so much in clinic, but when we become specialists in this area, we do a lot of planning for the community. And to be able to plan, you need to know your community well. So to know your community well, you have to go to reach them and see how they are doing. What are their problems?
Okay, so sounds very interesting, and definitely for someone who is drawn to dentistry from a preventive aspect.
You have to be a people person.
Yeah,
Take up this. You have to like people.
Exactly. And now moving on, Dr. Preethy, what about your area, which is actually two separate areas? Dr. Preethy? You seem to be
Hi,
Yeah.
good
Hi.
afternoon. Yeah, can you hear?
Yep.
Yes. Yeah, thank you everyone. So talking about this specialization, oral medicine and radiology. So there are two disciplines here. So I'd like to brief about the first one.
Mm-hmm.
Oral medicine, so basically it's deals with the diagnosis and non-surgical treatment of diseases affecting the oral cavity, okay, and the surrounding structures. Now, this is not purely dentistry because when you think of dentistry, you think of extraction, you think of a filling and a scaling procedure or
Yeah,
cleaning.
that's
But
right.
yes, but this branch it lies at the interface between medicine and dentistry. So that means we deal more with medically compromised patients. Like for instance, like if you walk into a hospital, you normally look at the signboards and you look for, like, if you have a cardiac problem, you consult a cardiac, you
Mm-hmm.
consult a cardiologist, or if it's a gastric problem, then you look at the gastroenterologist. So you have a
Yes.
lot of systems in the human body. So, and all these medical conditions, they do manifest in the oral cavity.
Oh,
So, yeah. So, in order to understand the oral manifestations, we need to look at the entire human body, understanding every system, and that's how we can diagnose any lesion or any condition that comes in the mouth. So,
okay.
yeah. So, based on the diagnosis, then we prescribe medications
Mm-hmm.
basically. And apart from that, we also do some behavioral therapy, like smoking cessation programs for smokers.
Okay. So this is
Yeah.
actually a interdisciplinary area, I would
Yes,
say.
yes, you're right. You're
Okay.
right.
All right. And what about radiology?
Okay, so radiology is all about exposure to radiation. You take X-rays, yeah, we process, we interpret, and we issue the reports. So X-rays, they actually act as an adjunct for diagnosis. The physician, he or she looks at the patient, listens to the patient's chief complaint. They gather all the information, but you get a clinical diagnosis. But that's not sufficient. So sometimes you need to see what is unseen. We see it in the X-rays. So you need the X-rays as well in order to arrive at a final diagnosis. And so this we actually cater every other specialist or every other branch in dentistry.
Right.
So
Now,
that's
Dr.
what.
Preethy, I
Yeah.
mean, as a dentist, everybody will need to know how to read X-rays, right? To take and read X-rays, even if they are in other areas of specialization.
Yes, yeah, to a certain extent, yes. Because if,
Okay.
yeah, for a general dental practitioner, if they're taking some intraoral X-rays, maybe for a decayed tooth, or maybe there is some periodontal problem, I think all dentists, as they pass out BDS, they are competent enough to read an X-ray.
Yeah. So, but
Yes.
specializing in oral radiology would be more than your run-of-the-mill, tooth extraction, that sort of diagnosis that you're talking about then.
Yes, and in oral radiology, yes, maybe a general dental practitioner would be, he would be knowing how to read, very simple intraoral X-rays.
Right.
But in this specialization, we have a trendy thing that has happened in the last 2 decades. We call it as a cone beam computed tomography. It's CBCT. Okay, this is you can say it's a tailored version for dentistry, because in medicine you have the CT scan. So
Right.
similarly, we have CBCT in radiology.
Okay.
So yeah,
So it's a more precise and more detailed, almost 3D type of X-ray
y-
or visual that comes out.
yes, correct. It's
Okay. Right.
three-dimensional.
And
Yes,
you'll be telling us a lot more about that later.
yes, yeah.
Okay, all right. So both very interesting areas, very, very different areas of specialization. So we would like to know, how did you decide in going into your area of specialty? Prof. Noorliza?
All right. Before I specialized, I was in the Ministry of Health, working in a very rural area in the state of Pahang.
Mm-hmm.
All right. My first posting was a place called Jerantut. Jerantut is a gateway to the national park, Tahan National, Gunung Tahan there,
Mm-hmm.
national park there.
Yeah.
So it is a very remote area with very less population. So
Right.
when I was working there, I realized that the people does not know that much about dentistry.
Mm.
So how do you educate a big community about dentistry? So you go in, I went into the community. They are from the rural areas like the Felda areas,
Mm.
where they don't know that much about dentistry. All they know is that pain. They have pain and they want to remove their teeth because of pain. But
Mm.
they didn't
Yeah.
understand the consequence of removing teeth will lead to more problems. All right.
Right.
So everybody has the idea that if you have pain, you have to remove your teeth.
That's true.
And I realize also the children, in fact, everybody doesn't brush their teeth. Okay.
Mm.
And when they don't brush their teeth, they don't know, then you have to tell them, we have learned so much about dentistry and they don't know. They have zero knowledge of the dentistry. So you have to educate them. How do we educate a big number of people who speak different languages, very Ulu language? I was from town area. Malacca is considered town, but
Mm-hmm.
that area of Jerantut has got their own slang, although they speak Bahasa Malaysia, but a
Mm.
different kind of language, and everybody is not aware. Huh? So I developed this interest to see that how can I help these people?
Mm-hmm.
So the only way to help these people is to educate them. But
Mm.
I can't do the job alone. All
Yes.
right. So that's why I was thinking after going into the community and observing the community, I have to do something to educate these people. Then I went into specialization and
Mm.
learning how to handle the community. So that's why I took up dental public health. All right.
Right. Okay.
Okay.
Okay. And what about you, Dr. Preethy? How did you decide that these were the areas that you wanted to go to into?
All right. So as you all know, now this BDS is a 4-year program plus 1 year of internship, and again, which is divided into the first two will be a more of a preclinical sciences, basic science, okay, where you get exposed to anatomy, histology, uh, physiology, biochemistry, and so on. And
Yep.
then in the year 3, year 4, we'll get training in various disciplines of dentistry, like in the extraction and root filling,
Yep.
dealing with perio problems. So as I finished this, the 1 year internship, I did practice in it's a government attached hospital. So
Mm.
there, it's actually a voluntary practice. And when I was practicing there, it was all to do with simple extractions and filling, like, 10 to 15 people just come straight away for extraction, and then you give them the injections, you make them wait out, and after about 10-15 minutes, the same patient comes back, and then you start doing the extractions. So, after working with them, I found out that there was some spark that was missing. What do I enjoy doing? So, I thought of specialization. So, like every parent, um, and my family members and my relatives, people whom I know, like they were all suggesting to go into conservative, or
Mhm. Yep.
to go into the
Well-known ones.
process. Yes, yeah, to
The
go
ones
into
that
the
you make lots of money.
yeah. So then, my answer was like, I was like just thinking, like, what was I interested in? Which field do I enjoy working with?
Right.
So my interest was inclined, towards the lesions which actually appear in the patient's mouth, and why do they happen? What are the causes? What is the mechanism behind it? How do we get it treated? So these were the things that came up to my mind, where there is some clinical correlation with the underlying mechanisms. So when I just did a research about this, I found that oral pathology and microbiology is, this is an interesting field.
Yeah.
This is one of the area where all the aspects that I had in my mind, it comes to into this field. So that's how I took this up. And then when I joined for my post graduation so this was in India, when I joined for my post graduation, in the first year, we were posted in oral medicine and radiology. So here we get a exposure to a lot of cases, history taking, and again we get training in the radiology department. We did ultrasound postings and so on. And the second and third year, we got training for grossing. You get specimens from the surgery department. So we dissect these specimens, we fix them onto the slides and stain them with the dyes, and then we view it under the microscope. But then again, to issue a biopsy report or a histopathologic diagnosis, you need to correlate with all the three, that is the clinical features, the radiographic, and the histologic, and then you get the diagnosis. So yeah, so there was some clinical pathologic correlation happening here. So that's about the specialization.
Okay, all right. Now, what was your specialization journey like? I mean, Prof. Noorliza, you said that you were working first and then only you decided to do that. And you did your diploma and your master's from the Royal College. What was that process like? I mean, could you do it locally in Malaysia or that sort of thing, or you had to get some experience out in England? Could you share with us on that?
Right, right. I graduated in the year 1985, and at that time there was only one university of teaching dentistry. That is University of Malaya. So at that time, 1985, we don't have any other universities. All other universities all come later. So to be qualified, you had to wait for scholarships because I cannot afford to go on my own. I don't have that much money. So I waited with in the government service. I waited for 12 years. On the
Wow.
12th year of my working, then I got the scholarship to go and study somewhere, because we cannot do it in Malaysia. There is no university in Malaysia doing this specialization course. So to be able to specialize, we have to go abroad, and to have to go abroad, I have to have scholarship. I can't afford to do it on my own and pay on my own money. So the waiting time, 12 years of waiting in the government service and in dental training college in Penang, that amount of time has given me a lot of opportunities to reach the public. So when I chose to do dental public health in UK, I came there with very much confidence, very much experience, work experience. So the journey of studying in UK becomes very easy, right? And I enjoy UK because we were once British colonized. So the British people know Malaysia very well. And our reputation as students, Malaysian students are all very good students. So we are well known there for hard work.
嗯，and I'm just going to ask you. So you were there for about what, 3 to 4 years, correct?
Yes, yes. Mm-hmm.
And of course, you in the area of public dental health, it gave
Yes.
you a front row seat to the British dental health, the community and stuff like that. Yeah.
Mhm.
How would you rate us comparing to them?
Oh, in UK, they also have the same problem. They have a big country with different administration, England, Wales, and they also have the same problem like us. Towns people are more aware. People in the rural are less aware of dental health. So whatever difficulties that we go through, they are going through the same thing. Okay, so learning becomes easy because we face the same problems. So when they have the first hand of handling things, of handling cases, or handling situations, we learn from each other. Although I was a student, a master student, but when we go there, we share the knowledge. And they appreciate because they also have rural areas. UK also have some rural areas where they have
That's right.
difficulty in delivering services, and the same problem of lack of awareness. So there are many similarities.
Yeah.
Right.
It's I mean, it's always a common misconception that public dental health is only relevant in developing or underdeveloped countries. But in truth, um, mouth issues plague every country, regardless of your status of development as a country. So that's great. Yeah. Okay. And what about you, Dr. Preethy?
Okay, talking about my specialization journey. Okay, here in our department, we basically teach and train our students with clinical skills, like examination procedures, because examination procedure is very important aspect of oral medicine. So the kind of, to describe about the scope of oral medicine, what are the kind of patients that we treat? So basically, patients who come here with complaints of limited mouth opening, they say they can't open their mouth due to some underlying problems, or they have joint problem. They come with facial pain, burning sensation. They say their mouth burns, when they eat spicy food, or headache and stuff like that. We also look into patients who have smoking habit, okay, or tobacco related problems, and we do the examination procedures for them, and we come to a diagnosis. So here I have a video, video to show, just to show one of the demonstration that we do here, how we train our students at Malacca Manipal.
Okay. Oh, let's go back to that one. And
All right, so this exercise, this demonstration that you have just seen is just one of the examination procedure that we do for patients who come with TMJ problems. So this is actually a good experience even for the students, because after we train them, we actually ask the students to enact, and we make such videos so that with all these students, they can just repeatedly see these videos, and help them to become more competent in these examination procedure. Apart from that, we also do a smoking cessation program. We actually train the students to inquire about the tobacco usage, and we inform them about the effects of smoking on oral health, like, discolored teeth or halitosis, that is bad odor coming from the mouth. And, we help them to quit smoking. We give them a quit date, and we give them some strategies of how you can keep away the urge to smoke. So, so this is again another program that we train here. We train, so we can say that this is the preventive aspect of oral medicine, more than the management part.
right.
Yeah.
And you also did a CBCT program, and you were telling us the cone-based CT scanner.
Computer tomography, yes.
Yeah.
So before going into that, just would like to proudly say that the machine that you can see here, okay, it's the Plan Maker, the CBCT machine. Now this, I should say that we were the first one in the whole of Malacca state to purchase this machine, which includes the three dimensional, and hence we get a lot of referral cases from outside, from GH Malacca and all the clinics that we have in Malacca. They refer for this CBCT, this radiograph, and we process it, and we issue the radiographic report. So how is this different? How does it help? Actually, in CBCT, it helps in a number of ways. It helps the implantologist, because now implant dentistry is getting very popular, very
Mm,
trendy. So an implantologist, before he actually places the implant within the bone. So what we do in CBCT is we provide a virtual simulation of the implant. We assess the bone, the available bone, how much of bone
mm,
height and bone width is there. We assess whether the bone is suitable for an implant, and we virtually place the implant, and we give these images um, to the general dental practitioner, and it's together with this they actually decide. It actually helps them to place the implant successfully.
right.
So yeah, so this is one of the application. But apart from that, CBCT also helps in other branches. Like it helps an endodontist,
Mm-hmm.
to find out if there is a missing or an additional root canal while he does the RCT. It helps the surgeon while doing an impaction surgery. It could be an impacted third molar. So
Mm-hmm.
to do a safe extraction. Again, this is where CBCT helps. A lot of applications of CBCT.
Mm-hmm.
Yeah.
Mm-hmm. Okay. And you've also done research.
Yes, yeah, I think research at Malacca Manipal, I think I should thank our dean and the institution for helping the faculty members as well as the students to strongly indulge in research. Because this research is one thing which we never had during our BDS days, and not so much of importance given for research. But I
Mm,
think all students who come to Malacca Manipal, they are so much privileged. It's such a golden opportunity for them to get indulged in a lot of research activities, and then present in the national conference. So
mm-hmm.
this is one advantage.
Respectful.
Yeah,
Yeah.
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 And apart from that, I also got opportunity to perform some radiographic techniques. So the photographs that you see here is where I went in for a workshop, to at Clinic Pergigian Limau, where I got to collaborate with the dental officers and the nurses coming all from all over the state of Malacca, from Jasin, Merlimau, and everywhere, and just training them the various radiographic techniques. So that was again a really amazing experience.
Okay. All right. Now we're going to talk a bit about the pros and cons of your area and specialization. And we'll start with Prof. Noorliza. You have mentioned that this is a very fulfilling one where you get to change lives in a big way and things like that. But what about the downside? The downside of being in public health.
Actually, I must say that there is no cons, no contrast in this specialty. All specialty of dentistry aims to help people. Okay, but the only difficulty is that we have to consider the community as a whole. All right, we cannot stay in our clinic and expect to do well for the community. All right, so we have to do something for the community. The only thing that can limit us is the budget, because when you want to have projects in the community, you have to have some money, right? We just can't go and talk like that, right? So we have to have a budget. So budget can be a bit difficult. But our intention is clear, is to educate the community regarding dentistry so that they know, and we can empower them to make the decisions. You can tell them about bridges and implants and so on, but the final decision is their decision, the community's decision. So how do we make the community able to decide if we don't educate them? So
Yeah.
slowly but surely, uh, the efforts doesn't change overnight, and also you cannot change people's behavior overnight, but by giving them some knowledge and some information, at least they can make some decisions. For example, why do I say this is a humble profession? Our intention is to help people maintain their teeth. Why is it important to maintain their teeth? Because we want them to have good quality of life. We want them to be beautiful. We want them to be able to eat and speak, and we want them to be able to eat, isn't it? Eating is a very big thing in
Right.
life. Right. So they have to have their teeth. And how do we educate them so that they will take care of these 32 teeth in their mouth for life until you go 6 feet underground? Huh? Try so trying to help them in the most economical way. You can help people by keeping the oral health healthy just by a simple toothbrush and toothpaste. Right. You don't have to have expensive items. You
Yeah.
don't have to pay so much for crowns and bridges. For example, you have a carrier's teeth. Before the teeth becomes caries, we do the prevention part. Prevent from caries, prevent from fear of extraction. So this is why I say this is a very humble profession. Although we are not specialized, the effects can be a bit sad sometimes when people don't understand you. But this actually motivates us to do more. All
Yeah.
right. So we
Yeah.
reach people from all the backgrounds when they are small, when they are still at a young age. This is where you try to change their habits so that when they grow older, they can maintain oral hygiene. All right.
That's right.
So this is where we go. We go everywhere, even in rural areas, even in Tadika, where children before they come to school, they go to preschools. We go to preschools, and it is not a one-man show. It is not only the responsibility of the dental officer. You need to engage with your nurses, your dental nurses,
Yep.
be able to reach all these people. This is where I said we have to be the people person. You have to like to be in the community with the people to carry on with this profession. To this
I must
profession.
admit, when I was a child back in my day, I'm not sure if they still have it, but the MOH would send the dental officer and the nurse down. We'll go out class by class, lined up to go to the little dental clinic on site, and they'll check us over, and then they'll give us a note that says like, okay, you've got this cavity, you've got that, you need this filling and that. Take the note home to our parents, and then they'll say that, okay, the next round they come back, only these students with this card have to come for your treatment. And I'll be one of those to pretend that I woke up with a cough or a fever on the day when they are coming back. But yeah, and
When I go to schools
mm,
during those times, during the 1980s, when we go to
yeah,
schools to check the children,
yeah,
when we go to schools, suddenly students are absent. They are
exactly.
nowhere. They hide in the toilet. They hide somewhere else. They don't want to be examined because of the fear. Why do they fear? Because they don't know. They think we are going to hurt them.
Yeah.
Right. So they don't understand the value of dental examination. All right.
Mm,
So my nurses have got to go and hunt for these children in the toilet, at the back of the lab. They are hiding, pretending not to hear their name being called. All right. So that is how the level before. Right. But now things have improved. But we still have to
exactly.
work further, work harder to make everybody orally fit.
Yeah. And I think your job is actually a little bit more difficult in this day and age with technology.
Yes.
They always say that, oh, a Google doctor, that's also a Google dentist.
Yes. Yes.
They have some pain and they go and Google the symptoms and they go like, oh, okay, it's this, it's that, and stuff like that.
That's right.
And yeah, and to educate people and in Malaysia recently, I mean, there's that entire spate of unlicensed practitioners, commercial dental products posing to be actual proper dental products.
Mm-hmm.
So your role has evolved with technology. How
Yes.
to
Yes.
educate the public that going to an accredited dentist, a licensed practitioner.
Yes.
I
Yes.
think this is the next phase. It's no longer just brush your teeth, good oral hygiene, but how do you even pick your dentist and the treatments that
Yes,
you're
yes.
going for? Yeah.
So
So
the
that's
only
yeah.
so I think the only way to reach everybody is to train more dentists for the country, right? So
That's right.
the country doesn't have enough dentists to cater for the population.
Yeah.
So that's why I now embark on teaching in a dental school with the
Mm,
aim of teaching more dentists and producing more dentists for the country so that the
mm.
dentist population ratio will be smaller.
Higher. Yeah. Sorry. Yeah.
For
Yeah.
example, now you take in the state of Sabah and Sarawak,
Mm.
one dentist to a 30,000 population. How do
It's
they do that? One
when you
dentist cannot do wonders,
right.
right? But in Klang Valley, 1 is to 4,000. One dentist can handle a smaller number because there is more people working in the towns. But what about those people in the rural areas? So now the way to forward is to train people, train students from rural areas so that after they graduate, they will go back to their own place and help their own people. So we have to be very kind, cruel to be kind in terms of selection. When we do selection, I think we have to give to some bearing for people who come from remote states.
Yeah.
For Sabah and Sarawak, for example, right?
Yep.
Okay,
Yep.
we have such a big square meter of country with less people. So after training these people in this field, now you will have you will see that there are many, especially Manipal graduates who are not from Sabah Sarawak, happy to go to Sarawak because I keep telling them that the best lab for training is the community. So if you see our graduates, first batch until the recent batch 5, many volunteered to work in the rural area because of their realization. When I give my lectures, I always tell them, it is important to consider working in the rural area. They don't have enough dentists there, so you have to go and help them. So voluntarily, our MMC graduates, they opt for Sabah and Sarawak. Meanwhile, we train more from Sabah and Sarawak so that these people can go back. And there are our students who doesn't want to come back. We have one from batch 1 who is from Melaka. She's from Melaka and she has been 6 years in Sabah, not wanting to come back, enjoying the life there, being with the community.
Yeah. And that's great, because while a lot of people think that going into dentistry, it's a very, very commercial idea. That at the heart of it, you must have the passion to want to change the world through the oral cavity. That's why I always tell students, I said, you can't tell me that, oh, I'll take medicine or dentistry, or I'm doing dentistry because they said it's better work-life balance. I said, no, there has to be a certain passion to either of it. And I always tell students, and I'm sure some of our listeners today would have heard it from me, I said, you have to be a very unique individual to want to pick dentistry because you're talking about working and looking into someone's mouth for 8 hours a day. And that's not an easy thing to do.
Right. You're right there.
Yeah. So moving on, Dr. Preethy, what about the pros and cons of your area? Because, our dean, Prof. Rashid, has always said that we are training our triple MC graduates to become oral physicians, and a large part of it is actually in your area, which is oral medicine specialization. It's not much heard of this field in Malaysia. So, is it a sustainable area, or it's always been there? It's just it never had a name to it.
All right. The pros for this is, as I said earlier, it deals with a lot of lesions and diseases, that you can see in the oral cavity, and it's just not the mouth. We have to deal with the whole human body. You need to have good knowledge about all the systems in the human body, as I said earlier. So, when you collaborate all this, it's actually very challenging. You need to master the skill of providing a diagnosis for this, and then again, managing them, prescribing medication. So it all follows. So the best thing in this is, the kind of cases that we get here. It's like a puzzle. So the joy is basically, solving the puzzle, and you give the medication to your patients, and then in the follow-up cases, they come back, doctor, my burning sensation is gone. Doctor, I don't have any more problems with my chewing. My muscles are fine. My joints are fine, and that's actually gives us the satisfaction, the joy within. So this is one good thing because, as I said, it's challenging. And on the other hand, when it comes to radiology, I should say that this is the only center for oral radiology where we do the reporting, because we do get a lot of cases from GH Malacca, where for requesting for CBCT, and we really take the pride in doing the reporting for them. We issue the reports from here, and so this is again another advantage in this field. But as you said just now, talking about the cons, Yes, I think the public awareness about oral medicine specialization is not much because as you say, traditional dentistry, everyone runs behind, getting the tooth extracted, a filling and drilling policy. So, not really into like understanding how the diseases occur, the mechanisms behind it, and why do they appear, and how you can manage it. So maybe yeah, people are not much aware, and
Yeah.
there are very few, just a handful of specialists, whether it's oral medicine or radiology in the whole of Malaysia. Maybe
Yeah.
less than 10, yeah.
I know. I have a TMJ issue. It took me forever to find a specialist.
You're
Yeah.
always welcome to our department.
I know. I will. You will get an email from me seeking an appointment.
Sure, sure. It's a pleasure to see you.
Yeah. Now, definitely, or both your areas is vastly different from the other areas of specialization like prosthodontics, orthodontics, and stuff like that. Because you, as Prof. Noorliza said from the start, you don't really do that run of the mill filling extraction kind of thing, right? But is there anything that you want to point out from your perspective on the similarities or differences, Prof. Noorliza?
Yes. So when you talk about dental public health, we are very much, like I said earlier, we are everywhere.
Mm,
In the hospital, for example, there are operation theaters for the oral maxillofacial people to get their treatment.
mhm,
But you must remember, before they have accidents,
mhm,
before they can have OTs and do the repair, we have to come up with some policies where we have to recommend to the higher authority. For example, now that we see a lot of accident cases, we must make sure that our motorcyclists are wearing helmets, isn't it?
yeah,
Our children, when they play contact sports, they must have mouth guard. All right, so that they won't fracture their teeth during games, contact sports like hockey and baseball. So that is where we come in. All right,
okay,
although hospital based, there is treatment in the hospital, but we do the preventive part where we recommend what is required for them not to have this kind of injury. And from the restorative aspect, we recommend to the higher authority that before children get dental lesions, okay, we need to put fluoride in the water. For
mm,
example, supplying water fluoridation, because fluoride has proven to reduce caries. Okay, so we prevent the disease before it comes, before it happens. Okay,
mm,
so in restorative, before people have to go for fillings, right,
mm,
we teach them from small that they must take good care, good oral hygiene, so that they can have good oral hygiene and do not have to go for treatment, which can be a bit costly. All right,
yeah, yeah,
and we also concentrate on a number of, if you see in this picture, okay,
mm,
these are
special needs.
special children. All
That's
right,
right.
they have the equal right for their health. But
Mm,
if you see, these special children do not come to the dental clinic because of many reasons, for economical reasons, for fear reasons, for many reasons. So how are these people going to get treated? They
that's
have some limitations. For example, like Down syndrome children, learning disability. Who takes care of their oral health? So this is where we have to specialize, go into this unfortunate people, so that we can have something for them, and
mm,
they can have the same rights like normal people.
right. Okay. What about you, Dr. Preethy?
Okay, the similarities with other dentists and with other specialized branches of dentistry is that they do the clinical examination. Then we also do the clinical examination. I think the rest of the thing is they're all similar. Okay, we do a similar job. But the difference is, as I said earlier, the traditional thought of dentistry, the fill and drill. So that is not there. We lack in that. But the good thing is, we master the skill of diagnosing and the whys and the causes of these, and we specialize. Our main area is, prescribing medications for these patients, and also, as I said, the behavioral therapy, especially for those patients who smoke, you know, educating them about the effect of tobacco, causing oral cancer and stuff like that. Yeah, so.
Okay. And I suppose you also do a lot of referral work, for example, where medication needs to be complemented with some kind of procedure, then you call on your colleagues in the various departments.
Yes, so that is where these dental considerations comes very important, especially for those who are medically compromised patients. Like, say, for instance, if a patient walks in for extraction, and
Mm,
if he is having high blood pressure, hypertensive, or if
mm,
he's taking aspirin, we need to make sure that his blood count is within the well range, so that the extraction is safe, and it doesn't leads to heavy bleeding. So for such patients, who takes aspirin, we need to get in touch with their physician, saying that, oh, we are opting for an extraction in this patient, and we need to get a fitness certificate from the physician,
mm.
saying that extraction is safe. So this is how, we get in touch. We collaborate with the various specialization areas of medicine.
Okay,
Yeah.
excellent, excellent. Okay, to wrap things up, both your fields have actually been very enlightening, and I'm sure our viewers would agree that you've given them a lot more to think about in terms of possible specialization areas in the future. In closing, Dr. Noorliza, any words of wisdom for our future dentists tuning in
Yes.
today?
Yes. Now I want to tell the future dentists that we cannot wait for people to come to clinic. We need to go to them. We need to reach the community, because when we go into the community, then we will know the real problem. Because
Mm,
not everybody likes coming to the dental clinic,
yep.
right? So people have fear. We need to know why they are afraid of dental clinic. And we also want to highlight that curative treatment is not the only way to have dental nice set of teeth. All right, you can have a good set of teeth without having to pay hundreds of dollars by just applying your toothbrush and toothpaste and brush regularly. So the scientific evidence or the scientific knowledge have to be transferred to the patient, so that they will be empowered to take care of their oral hygiene. And for us in dental public health, health is not for sale. We don't go for the money. All right.
Mm,
Orthodontist or conservative or prosthetic can bring a lot of money, but we don't go for that. Right. We
mm,
want to go to where the people are, understand what are their problems, and try to help their problem. And in doing so, we need to reach the public. You need to be at the same level with the public. The public has got to be familiar with you. They
mm.
feel at ease with you. Now, to be able to feel at ease, you have to be with them. So this is where in our curriculum, we encourage our students to take part in all these activities. Be everywhere, so that you can open your eyes. At any opportunities you can highlight about dental, you will go in. So
Mm.
we go to rural communities. Even our dental officers also help with COVID screening, not just the medical nurses and the medical people. And we go to community activities such as rural posting or mercy. Even if we cannot go to overseas mercy, but at least we are doing something to help.
That's right.
Students during their holidays, they are engaged with mercy, help packing things before things are transported abroad, send food, soup kitchen, for example. Our students are involved in soup kitchen, providing food for the poor. Just be there, to know, to let the population know that you care for them. So this is a very caring profession. Community is a very caring profession, in the sense that you want people to know that the dentist cares. And how do you make sure that they know the dentist cares? The dentist has to come and be with them. Then they will know that the dentist really cares.
That's right.
Right.
And even I think on that note, even if someone is in the slightly more commercial field, like orthodontics and stuff like that, by donating your time and services, on your clinic off days, it's also very
Yes.
rewarding.
And I have students when we do community visits. I have students who also, after giving them a knowledge, they spend an hour or two in their own time, going to old folks' home, help the old folks to comb their hair, bathe them. These are some community things, humanizing, making you human.
Yeah.
Right. So we have students who goes into the community after our module. They begin to like to join the community, like to join activities, and on their own, they create their own networking. They
Yeah.
create their own people. So, for example, recently, one student in Sabah, after learning, she's in fourth year now. So, after learning about dentistry, she calls back, "Ma'am, can I do something for dental health education?" Sure, why not? You need to educate your people. And even so, if you're not a qualified dentist yet, but you do what the part that you can.
That's right.
So help people to brush, convey the message in your own language to
That's
your
right.
own clan of people, because
Yeah.
Sabah has got more than 300 slang or dialects. So if you
Yeah.
are dealing with your people, you can help. So she participated in an activity in the community, volunteered to participate and do the dental part. This is how
Okay.
we train them, and when they go out into the public or the community, they are very confident in talking about dentistry.
Excellent. Excellent. Now, Dr. Preethy, what about you? Words of wisdom for future dentists.
All right. For the future dentists, for the budding dental students here, I would say that Malacca Manipal is the best place because we have the finest, we have the experts, faculty members from all the fields. So now, if you have already decided to embark into dentistry, I just give you a warm welcome. Welcome to Malacca Manipal. But at the same time, if you are, still thinking about dentistry, I would like you to, just think for some time. You need to discover what is your interest, because later when you join for job, or or whether you put up a dental practice, um, a private practice, you should be loving your job. You should be passionate about your job. So you need to discover what your interest is. And secondly, dentistry, it's a noble profession. Dentistry is all about your focus. Your customers are your patients, and you need to have that empathy. You need to have that mind to understand the feelings of your patient, and do the treatment. At the end of the day, you need to make your patients happy. So it involves both empathy, and it also involves the art, or the skill of working on them. And the final word of wisdom is, once you step into dentistry, or any medical related health profession, it's a lifelong learning process. You keep learning, and you need to keep learning. You need to update, because technology, in terms of technology, it's advancing, it's emerging, whether it's the machines, or whether it's the medications that we prescribe. It keeps changing every day. So you need to keep updated, even if you pass out from here, throughout your career, wherever you are. So yeah.
Okay, thank you so much, Profs. For our viewers, you've been tuning in to the Malacca Manipal Medical College Specialization series, focusing on the dentist road to specialization. Both professors that you heard today are faculty members of our Bachelor's of Dental Surgery program, which is a 5-year program that takes in 75 students per intake. And the intake typically happens in October. It's our facilities are located in Malacca, and in Malacca itself, our on-site clinic sees over 30,000 patients per year, which gives all our students excellent opportunities to fine-tune their clinical skills during years 3, 4, and 5, right? So if you're still shopping around for a dental degree, hope you consider us. We are one of Malaysia's oldest and most established private medical dental college. We've got, as I said, the on-site clinic, which gives you lots of patient exposure. We're located in the city of Malacca, where Malaccans welcome you as one of their own. So no one is actually going to say, "Don't touch me. I don't want you doing the stuff for me." And we've got faculty members like Prof. Noorliza, Dr. Preethy, who has worked around the world to help you in deciding on your postgraduate training. Okay, so we don't seem to have any questions. I'm not surprised. Both professors gave us very, very clear insights and inspirations into their field. So we'd like to thank Prof. Noorliza and Associate Professor Dr. Preethy for joining us today, and to our viewers as well. If you've not followed us on Facebook, please do. It's Triple MC Malaysia. I repeat, Triple MC Malaysia. And as we all know, a dentist gets to the root of the problem. We hope that today's seminar has given you tremendous insights and inspirations for your journey ahead. My name is Barbara, signing off from Malacca Manipal Medical College. Have a great weekend.